Hi there, my name is Dr. Arlene Dubier. I'm a naturopathic doctor and birth doula at Proactive Pelvic Health Clinic. Today we're going to be talking about a few tips and tricks to help protect your pelvic floor during labor. So the biggest question that I get asked from parents is, how do I prevent an injury or tear to the perineum? So the perineum is that area that is between the vagina and the anus, which commonly can get injured during the pushing stage of labor, especially if pushing lasts a long time. So first of all, I do want to normalize injury to the perineum. It can happen, although there are things that we can do to hopefully help prevent that. So number one is something called a perennial massage. You can Google how to do that. It's something yourself, your partner, your pelvic floor physio can help you with. And it's essentially just a way to kind of stretch those tissues of the perineum and kind of get used to what that sensation feels like. And again, stretch and help prepare you for pushing. Number two is discussing with your care provider beforehand if you want them to coach you on pushing. So this is for people, if you've had an epidural, you might not be able to feel the sensations or any additional pressure on your perineum. So you can ask your OB or your midwife to either let you know when you should stop pushing, or have a warm compress on hand to add heat to the perineum and again help support that stretching. Number three is that there are actually a few different positions that can help protect your pelvic floor. So any position that you're pushing in that uses gravity is really great. So if you have a squat bar on hand, if you're able to squat or lunge, that's wonderful. If you have an epidural, side lying is also another good option because it doesn't put as much pressure on your pelvic floor. Number four is delaying pushing. So again, I talked about if that pushing phase lasts a long time, so over a few hours, a couple hours, or even just 1 hour, it can put a lot of pressure, of course, on your pelvic floor. So when you get to 10 centimeters, if your baby is still high and has not yet started crowning, you might want to wait a little bit. It's a process called laboring down. So you might want to wait and let your body do the work, let the contractions get your baby lower to start crowning so that when you do start pushing, it's more effective and doesn't, again, put as much pressure on your pelvic floor. Where am I? I think number five. Number five is pushing with your knees slightly inward. So this is if you're lying on your back, or again, if you're on hands and knees. If your knees are slightly inwards, it actually opens up that pelvic outlet and makes more space for your baby. Number six is seeing a practitioner who can help you with body work. So there are sometimes muscles that can be tight and can prevent your baby from dropping lower and getting to that crowning time. So that includes practitioners such as a pelvic floor physiotherapist, an osteopath, a massage therapist, a prenatal chiropractor, a naturopath, doula, anyone who does acupuncture, and they can kind of give you more information and tips on how to prevent any injury to your pelvic floor. If you have any questions, feel free to write them down below.